So, yeah, Axel, please take us through a similar sort of parallel narrative.
Okay, thanks very much, Mike, for the kind introduction. I'll try to race through my slides. I think it's important to start off with the background. I didn't start off as an expert on Khat. I'm not even sure whether the appellation really fits me, but I'm happy to talk about it. It started off when in '98 I was invited as part of a team to do an assessment of drug problems in Africa. And they got a bunch of anthropologists and economists to go around different African countries and look at the drug problems that arose, with a view very much towards coming up with policy suggestions. And one of the issues that arose, particularly in Ethiopia and Kenya, was this issue of Khat. And our interlocutors, who were mainly UN agents, very much sort of described it in the terms of it being a problem. So we got together afterwards and applied for new funding, which took a long time in getting, to look at it at a much deeper level. And we had an interdisciplinary team comprising a couple of anthropologists, an historian and an economist. And we followed Khat from the field to the mouth. And the wonderful parallel with coca is, of course, that these are leaves that are there that are good for chewing. And we sort of traced it, and we could only really do the study because Khat is still, for the time being, touch wood, illicit substance in many countries. Not everywhere, but in many countries, unlike coca leaves. It's not been subjected to international agreements as yet. But the interesting thing about Khat, that originally it is what psychologists refer to as a culture-bound drug, which I always thought is a fascinating sort of form of nomenclature, you know, which substance isn't culture-bound. But anyway, it was sort of confined to this area, the highlands of Yemen, Ethiopia, and Kenya. And it's a drug that only grows in a certain altitude, 800 to 1,500 meters, ideally speaking. And the ingredients, caffeine and cathinone, are the ones that are best understood. Some of the other caffeidolins haven't really been investigated properly yet. But caffeine and cathinone, particularly cathinone, which I think sort of works on serotonin levels and so on and gives you the euphoric effect, that decomposes within 72 hours. So you've got a very narrow window. And as a result, the consumption was confined to the areas which were either the producing areas or adjacent to. And what you then have with the early 20th century, railway tracks are being laid, and suddenly farmers can start putting their harvest on the railway and discover new markets, explore new markets. And then the next leap comes about 20 years ago when you can stick it on airplanes. And now with the diaspora, with having diasporas of Kenyans, Yemenis, and Somalis all over Europe, North America, there's an international market and it's become a global commodity. Something which about 10 to 20 million people are estimated to be using it and all over the world. It's grown in these fields. It sort of grows up to this height. People say you can get 2 or 3 harvests a year. Most of the production in Kenya and Ethiopia, also in Yemen, is done by smallholders. But I want to talk about Ethiopia and Kenya mainly because they are the main exporters. Yemen consumes most of its own production. It is very popular with farmers because it's a hardy plant. It doesn't need many sort of fertilizers and other sort of inputs that are costly. But most important for farmers, particularly in countries like the Horn of Africa, where margins of subsistence are very, very sort of dicey, the prices are very stable. Khat is sort of harvested. It's these shoots that are then harvested and put into bundles, and they're sold locally the way they are. But when they go into export, to make them last a bit longer, they're packed into these, which is called a marduf. And this is a banana leaf, and the banana leaf it's a wonderfully organic packaging. I mean, all of it is biodegradable. You couldn't beat it if you tried. And so if you want to sort of pass it around, that sort of trades for about £5 in London. And people will go through one of these at a session. Now, since you're all novices, I would not encourage you to take the whole lot, but I would ask you to take a few of these, and you can sort of stick in your mouth and chew it and see what it does to you. Most people survive this experiment. The effects and hazards, I mean, within about an hour you get the euphoric effect. It's called the Mirakan. It is a stimulant. It goes up. It takes you up. And then you become very talkative. I remember doing my field work. I didn't have any notes afterwards because I was talking as busily as everybody else was. And then afterwards you sort of descend into this sort of more reflective mood, and afterwards you come with many drugs. You pay the price for what you had afterwards, and you're irritable and restless. There are various sort of side effects. There's a whole industry trying to identify the various psychological problems that are associated with it. But these are all based on case studies. Usually people who walk into a psychiatric clinic and say, well, they've got present with certain symptoms, and Khat use is associated as one of the factors in their condition. There are various physical effects as well, none of them really well substantiated, and always in association with excessive use. These are the Khat sellers, and again the interesting thing about this commodity is it is now the second largest export commodity of Ethiopia. The commodity chain is entirely in the hands of Africans, unlike, let's say, other exports, be it coffee or so on, where multinational companies take over the production, or be it roses or fresh fruit and so on. And interestingly, it's mainly women who are selling. It's retailers, like these ladies here. She's in Ethiopia, this is in Ethiopia, and I think this is in Somaliland. And it's one of the few trading items in the Horn of Africa that actually creates linkages between neighboring countries, because most African countries have trade linkages with Europe and North America, but not with their neighbors. So here you have a degree of integration. Ethiopia will export the Khat, but it's mainly Somali transport companies that carry it, for instance. So people get diverse benefits.